Melatonin is often used for short-term treatment of trouble sleeping, also known as insomnia. It can be helpful for people who have trouble falling asleep, waking up frequently during the night, or have difficulty staying asleep. Melatonin is a natural substance produced by the body that helps regulate our daily cycles, hormone production, and sleep patterns. It's important to note that some herbal and dietary supplement products may contain harmful impurities or additives, so it's best to check with your pharmacist for more information about the specific brand you are using. Additionally, the FDA has not reviewed this product for safety or effectiveness, so it's a good idea to consult with your doctor or pharmacist for more details. When it comes to dosing, the recommended amount of Kids Melatonin 1 mg Chewable Tablet Hypnotics can vary based on age and individual needs. It is usually taken 30 minutes before bedtime to help promote sleep. As always, it's important to follow the instructions on the product label and consult with a healthcare professional for personalized recommendations. This medication is taken by mouth with or without food, usually before bedtime or as directed by the package label. It's important to follow all directions on the product package. If you have any questions, ask your doctor or pharmacist. When taking this medication, make sure you have at least 6 to 8 hours of time for sleep afterward. Dosage is based on your age, medical condition, and response to treatment. If you are using the extended-release tablets, do not crush or chew them. If using the chewable form, chew thoroughly before swallowing. If using a liquid form, carefully measure your dose using a medication measuring device or spoon. Do not use a household spoon because you may not get the correct dose. Some brands of this medication should be shaken well before each use. If using the rapidly dissolving tablets, dry your hands before handling the tablet. Follow your brand's directions for placing your dose either on or under the tongue. Allow it to dissolve completely, then swallow it with saliva. You do not need to take this medication with water. This medication may start to work within 30 minutes. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. Some common side effects of Kids Melatonin 1 mg Chewable Tablet Hypnotics may include headache, dizziness, shaking, nausea, or abdominal cramps. If any of these effects persist or worsen, it is important to consult your doctor or pharmacist. This product may also cause drowsiness or reduced alertness during the day, so it's important to talk to your healthcare provider if you experience daytime drowsiness. It is important to seek immediate medical attention if you experience any serious side effects, such as changes in mental/mood, such as depression or confusion. While allergic reactions to this product are rare, it's crucial to get medical help right away if you notice any signs of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not mentioned, it's important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before giving Kids Melatonin 1 mg chewable tablets, it's important to know if your child is allergic to melatonin or any other ingredients in the product. This includes consulting with a healthcare professional if your child has diabetes, high blood pressure, an immune system disorder, liver disease, mental/mood disorder, or a seizure disorder. It's also important to be cautious if your child will be using the liquid or chewable forms of this product, as they may contain sugar or aspartame. If your child has diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires them to limit or avoid these substances in their diet, be sure to consult a doctor or pharmacist before use. It's also important to note that children may be more sensitive to the side effects of this product, such as changes in sexual development, so consulting a doctor for details is advised. If your child is pregnant, it should only be used when clearly needed, as it may have an effect on the release of eggs. If pregnancy is being planned, if the child becomes pregnant, or if there's a possibility of pregnancy, it's important to discuss the benefits and risks of using this medication during pregnancy with a doctor. This medication also passes into breast milk, so it's important to consult a doctor before breastfeeding. It's important to be aware of potential interactions with other medications when taking Kids Melatonin 1 mg Chewable Tablet Hypnotics. Some drugs that may interact with this product include blood thinners, blood pressure medications, products containing caffeine, medications that may affect your immune system, and fluvoxamine. Additionally, it's important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's also essential to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Be sure to ask your pharmacist about using those products safely. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Make sure to keep all scheduled medical and laboratory appointments. This will help ensure that the medication is working effectively and that your child's health is being closely monitored. It's important to stay on top of these appointments to ensure the best possible outcome for your child's health. This product is used to help children fall asleep. It is used to treat sleep problems, insomnia. It may help you fall asleep faster, stay asleep longer, and wake up less often during the night. It may also improve the quality of your sleep. The package will have information on how to store the medication, so be sure to check that. If you're unsure about how to store it, you can always ask your pharmacist for guidance. It's important to keep all medications and herbal products out of reach of children and pets. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless you're told to do so. Instead, make sure to properly dispose of the product when it's expired or you no longer need it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.